Hello friends, Bangalore is going through one of the toughest COVID pandemic times. There are about 39,200 confirmed cases by the end of 23rd of July 2020. Out of which 29,090 are active cases in the Bangalore area alone. But there is a mystery in the Bangalore city that the government is hiding from us. The mystery is, it came from a news article, it's a news report from Times of India, 23rd July. They say 11,000 positive patients are missing. The government has no clue. The BBMP has no clue. The health infrastructure, the health ministry, the entire system has no clue where these 11,000 active patients gone. But there is also a constant concern that when people are testing positive and they're trying to search for a bed, they are just not able to get one bed. They're moving from a hospital to hospital, but they have been denied of a bed. But people are facing these difficulties. And they are facing these difficulties at the same time they're losing their lives. Who is responsible for this? But before all that, let us understand what do we have as the health infrastructure in Bangalore. Let us get into some details. According to the government sources, we have about 13,012 COVID beds, out of which 6,498 beds are occupied. Out of all the active cases, the government has a data of about 10,319 active patients who are either home quarantined or they are in self-isolation. When you add these two figures, you basically get 16,817 total number. But our active cases as of today is 29,090. It means we are missing nearly 12 to 13,000 people who are missing from the systems. At the same time, the BBMP says that 6,500 beds are vacant. Who is lying? Either the report or the numbers or the tested confirmed numbers are false, or the claim of the BBMP and the health ministry is wrong. Something is wrong, but definitely the government here is to be blamed. When asked to X number of the officials, they say that we are tracking, we have the patients have given a wrong number, they have given a wrong address, and they are not able to, figure them out where they are. They're not able to locate them. They're saying they're using the police department to locate them. That will happen over a period of time. By then, we would have added another 10,000 numbers to the active cases or the confirmed cases. But now the question today is that we need to ask this government, what are you doing to the people of Karnataka, to the people of Bangalore? Why the safe city has become a pandemic city? Why are the people not able to get a bed in a COVID center? When this was asked to Mr. Sudhakar, in his statement he says that we will take appropriate or we will take steps to ensure that these patients get reflected in the system. My dear friend, what were you doing till now? Sri Ramulu, the health minister Sri Ramulu seems to be saying, I will resign if I am being, held guilty of even 1 rupee of misappropriation. Why do you want to resign? Then resign now, when you are not able to locate the patients and when they are susceptible, when they can become the source of infection to thousands of people across the city. What are you doing about these 11,000 patients? You have no idea what is happening. You don't know where the source is coming from. You don't know how people are getting infected. So how are you going to control it? Mr. Yediyurappa he's taking constant meetings. He is giving ultimatums to his ministers. He's giving ultimatums to his officers. but nothing seems to be working on the ground. They're busy buying ventilators at the highest cost. They're busy buying PPE kits at the high cost. They're busy buying, the sanitizers. They're busy doing all sort of purchasing items. But their job as of now is to take care of the people in the city so that we don't have more calamities. We don't have more deaths. We don't have people losing their family members. But the government is insensitive about the life and the death, but they are more busy about their purchases and the expenditure. When the IS officer from the COVID war room, Hepzibah Rani Korlapati, was asked, this officer says while 20% of these patients have been admitted in private hospitals and are yet to be identified, the remaining 80% have given wrong mobile numbers or wrong addresses while undergoing the COVID test. And we will this is a challenge. It's a challenge to track them. Police are helping us, and we will set right the data flow in 2 days. Where were you when the tests were done? Where were you that you were supposed to isolate these people, give them the treatment so that they could get back to their family members, but you have chosen to sit back, relax, thinking that this 7 days or 8 days of lockdown would bring back, reset the whole button. And you have done exactly the wrong. You have done something wrong that what Mr. Modi did, saying that if I lock down for 21 days, the whole virus would be wiped out from the land of India. And you have exactly tried the same thing by doing this another 8 days of lockdown. But you have not set right anything in these 8 days. The people, the number of active patients, cases have not reduced. At the same time, the number of confirmed cases seem to be going higher and higher day by day. But when will this government become more responsible? When will Mr. Yediyurappa take the responsibility of this kind of a disaster? When will Mr. Sri Ramalu, who is the health minister, will take the responsibility of his failures? When will Mr. Sudhakar take the responsibility of his responsibility from the COVID, responsibility that he was given? When will Mr. Ashwath Narayan take responsibility as a deputy CM? When will Mr. Ashok take responsibility for the failure by pushing the entire state and the city into extreme danger, into an extreme pandemic situation? And you seem to be still not being sensitive to the people's requests, people's wishes, people's need as of now. I demand, and I request, it's every possible adjective that we can use. Take appropriate action to arrest the rise of these active cases. If not, I suggest that you put your papers down. There will be more responsible people who will take over and handle the situation with more professionalism. Thank you so much.